Welcome and thank you for joining us today for this two-part series focusing on how we make an impact. My name is Karen Smoller and I am one of the co-chairs of the program along with Jim Deutsch. The Professional Society would like to welcome our members and guests and thank our sponsor Reuben Brown for their ongoing support. We all know that Federation does incredible work raising over $9 million through the annual campaign. But how do we invest those dollars to create impact? Similar to many of you with a business model within your own organizations, the Federation has a strategic plan, priorities, and a business model as well. You will be impressed to learn about the incredible community impact team that focuses their efforts on this work in partnership with many volunteers under the leadership of Craig Rosenthal, who is Vice Chair of Community Impact. In this session, Nava Cantor will focus on assessment and planning. Nava has been at Federation for 3 years and staffs the Assessment and Planning Subcommittee, co-chaired by Tim Stern and Rob Wasserman. Next session, Emily Bornstein will focus on investment and evaluation. If you registered for today's program, you are automatically registered for next week as well. Before we get started, I would like to quickly introduce Ellen Sewell, who is new to the staff team at Federation. Ellen is the Professional Society and Corporate Partnerships Officer, and we are so excited to have her. Welcome, Ellen.
Thank you very much. Glad to be here. Thank you.
With that, I will turn it over to Emily to get us started.
Thanks so much for that introduction, Karen. Nava and I are really excited to share our work with you all over these 2 sessions. As Karen mentioned, today's session will focus on community assessment and planning. But first, I'm going to start with an overview of Federation's core commitments and priorities. And for those of you who don't know me, I'm our Director of Community Investment and Evaluation. So these are Federation's core commitments, which were adopted with our 2017 strategic plan. These 4 core commitments are how we focus our mission and organize our priorities. Everything we do is aimed at creating a vibrant St. Louis Jewish community, securing the well-being and safety of the Jewish community, strengthening our connection to Israel and Jews around the world, and developing the resources and infrastructure our community needs. Priorities within each core commitment determine how we assess our community's needs and shape how we make community investments. That's what we call our grants. Within each core commitment, we have high, medium, and low priorities, which were set by our board of directors. I'm going to go through each one and show you the high priorities so that you have a sense of what we mean by each core commitment. So when we think about expanding and strengthening a vibrant community, we think about creating a thriving local Jewish community across the spectrum of Jewish life. We think about Jewish social networks, Jewish education, Jewish values, and creating a welcoming and engaging community. Our priorities within this core commitment focus on populations. Our high priorities are early childhood and families with young children, school-age children and their parents, young adults, and reaching the people who are moderately engaged. This core commitment is about caring for people in need and making sure that people can live with dignity. It also includes communal safety and security. Our high priorities here are elderly Jews at risk, providing a safety net for those living in or near poverty, safety and security, and mental health. Strengthening our connection to Israel and Jewish people worldwide is about recognizing our responsibility to support Jewish communities around the world, from the former Soviet Union to Yokneam and Megiddo, our partnership region in Israel. Our priorities here, our high priorities, are global Jewry, Israeli civil society, which talks about Jewish pluralism in Israel, and Arab Israeli and Jewish Israeli shared society, social welfare, which we focus in our partnership region, and Israel education locally. And this last core commitment is about making sure that our local Jewish community has the muscles and bones that it needs to function and thrive. Our high priorities here are to recruit and develop lay leaders to serve the Jewish community, to attract and retain high quality professional staff for Jewish organizations, and to promote and increase opportunities for collaboration among Jewish organizations. So now that we've talked a little bit through what each of these core commitments is about, let's bring this back to you all. You're here for a reason, you care about our work. We'd like you to think about what resonates. Pass it over to Nava to talk about community assessment and planning.
Great. Can everyone see the core commitment slide again?
Yeah.
Wonderful.
Yeah.
Thank you so much, Emily, for getting us started and grounding us in the core commitments. Why are we here? What is the point of Federation? It's really helpful to start there. Hi, everyone. I'm Nava. I'm Federation's Manager of Community Assessment and Planning, and I'm excited to talk with you today. So the first thing we're going to talk about is at a high level, how does Federation create impact in the community? We do that by using this 6-step process that brings together volunteers, lay leaders, professional staff from both Federation and many local partner organizations, all of whom work together to create change in the community. And this model is what gets us from the ideas of our core commitments to action and change in our community. So first, I'll talk through this model at a high level, and then I'm going to walk through a specific example of how we've used it and focus on the assessment and planning part, which is my piece of the puzzle. So if you look at the top of the cycle in step 1, Emily shared some examples of the priorities that our board has set. That's where we start. The board establishes priorities within each core commitment to focus our work. Then in steps 2 and 3, we're working on assessing the needs in our community for each priority, and then developing strategies and plans to address the identified needs. This work is overseen by a lay committee, the Assessment and Planning Committee, and I work with them to understand what's going on in the community within each priority. And we'll talk more about specifically what that looks like. And then we work with community partners to create plans to address whatever needs came up in our assessment. Then at the bottom of the circle, you'll see step 4, which is raising financial resources to support community needs. So our development team, in partnership with their development lay leaders, raises money to invest in the plans that are developed so that we can actually make them happen in the community. And then moving over to the left side of the circle, steps 5 and 6 go together. That's Emily's piece of the puzzle, working with her subcommittee, and you're going to hear a lot more details about that next week at the second part of this program. After we have identified our needs, made our plans, raised our financial resources, we then invest those funds to meet the identified needs, and we evaluate the impact of our investments to understand if we have achieved the change that we wanted to make in the community. So today we're going to be focusing on steps 2 and 3 on the right side of the model. So first, let's dig into what I'm talking about when I'm saying needs assessment. That may or may not be a familiar term for people. At the top of this slide are some examples of components of a needs assessment. So a needs assessment could be looking at existing data about a particular issue, could be conducting a literature review focused on best practices or figuring out what else is going on around the country about a specific priority. It could be conducting an environmental scan, which is figuring out what already exists in our community. So you can figure out gaps that way by doing that scan. It's also really important to obtain input from the affected population that you're talking about through focus groups, surveys, interviews, things like that. And it can also be really important to obtain input, organization level input from organizations that work with that affected population. We have such a wide variety of priorities that we're charged with assessing, as you could see in all the priorities that Emily went through, that the same needs assessment approach does not fit them all. We need to figure out each time we're looking at a different priority, which of these components do we need to bring together to paint our, to understand well what's going on in our community and that priority. So a really thorough needs assessment might include every single one of the bullet points at the top of the slide. And sometimes we will have the need, the time, the resources to do that kind of Cadillac version, that really comprehensive version of a needs assessment. Other times we actually don't need to do the most comprehensive approach. We might be able to do a briefer version that can still give us data that we can act on and help us understand the needs in our community. And sometimes there's already data out there that we can utilize. So it just looks different every time. And that's, I'm showing that in this needs assessment spectrum at the bottom of the slide. Some will be more comprehensive, some will be less comprehensive, but as long as they're giving us actionable information that we can use to meet needs in our community, that's our goal. And determining the right approach for each different needs assessment project is a really important piece of the process where the lay subcommittee, the assessment and planning subcommittee, plays a role. So once we've identified needs and gaps in our community, it's time to figure out how we respond to what we found. And that's what the planning process does. We need to consider what changes need to happen in the community in order to address the needs or fill the gaps that we've identified. And we also need to think through the scope of what needs to happen in order to create those changes and who needs to be part of all of these planning conversations. Which service providers and organizations need to be a part of it, which community leaders, which community members, and what role should Federation play? Should it be more directive or more facilitative? There's a lot of different ways to approach this kind of community planning process. So at the top of this slide, I've just put a bunch of different examples of what the result of a planning process can be. And as you can see, the universe of what plans can look like is very wide. It's huge. It could involve creating a major new community initiative, or it could look like creating a series of training workshops to help our organizations learn a specific thing that they need to learn, build their capacity. Or it might be convening a roundtable of stakeholders to support them in responding to the needs that we've identified. There's a lot of room for creativity here, and we really need that creativity to effectively figure out how to meet our community's needs. And just like needs assessment, we also have a planning spectrum. On the one end, a plan might be more centralized, more fully developed, led by Federation. On the other side, it might be less centralized. It might be strategies that we're supporting our community partners in implementing. And just like needs assessment, we'll have plans that fall all along that spectrum. So now we're going to get more concrete, and I'm going to walk through a specific example of an assessment and planning process that we've been working on this year in 2021, which is focused on supporting the mental health and well-being of young adults in our community. So as you've heard from Emily, the first step in our 6-step model is to establish priorities. So in this case, in 2018, Federation's board of directors set mental health as a high priority within our core commitment around well-being and safety of Jewish people in St. Louis. So that's our starting point. Step 2 is understanding the need. So from the beginning of COVID, this will come to, as news to none of you, lots of people around the world have struggled with their mental health. Isolation and fear and rapid change have all impacted people's abilities to cope with both existing and newly emerging stressors during the pandemic. And Federation conducted several community needs assessments during the pandemic about the impact of the pandemic on people in our community. And those showed that one group in particular was struggling with mental health, and that was young adults. So Brandeis University researchers did a study here last year of the impact of the pandemic on our community. And they found that young adults in our St. Louis Jewish community had more trouble coping with the psychological effects of the pandemic than people of other ages. And that actually holds true nationally as well. That's a broader trend that's happening here too. And we also knew anecdotally that mental health issues among young adults in our community were a concern before COVID hit. And the pandemic exacerbated them. So based on all of this data, we decided to focus in on this particular population to do some community planning to address these needs. So step 3 is developing strategies and plans. Our approach to planning in this particular case was to gather a roundtable of 26 leaders and stakeholders from across the Jewish community. And that was a mix of young adults, people who work with young adults, and people with professional mental health care expertise. So a wide range of perspectives coming together through this process. And this group participated in a design thinking process that centered the experiences and stories of young adults who had been experiencing challenges with their mental health during the pandemic. And this process supported this roundtable group in generating ideas that could positively impact mental health and well-being of local Jewish young adults. And a major part of this process was not only generating these ideas, but gathering lots of rounds of feedback on the ideas from additional young Jewish adults in the community who had been experiencing mental health challenges. So the outcome of this process was 9 strategies for a community level response to this issue. And they focus on building resilience and supportive community connections during the pandemic and beyond. I think it's important to note that initially, sometimes in the middle of a planning process, you learn things that kind of make you shift the direction that you've been going. So initially, we framed this project specifically around mental health during the pandemic because we had this specific data from that Brandeis study that told us that it was an issue. But as I mentioned earlier, we knew that this was an issue before the pandemic too. This wasn't brand new, even though it was being exacerbated during the pandemic. And we also heard as we talked to more young adults throughout this process that the experiences they were having and the issues they were facing went beyond the fear and isolation and disconnection of the pandemic. It was really also connected to a wider context of major societal challenges and changes like racism and climate change and political tensions that really also weigh heavily on this population. So for those reasons, we felt that it was really important to broaden our approach to not just focus on supporting people during COVID, but really building community resilience during COVID and beyond. So these are our 9 strategies. Give you a minute to look them over. You'll see that there's a pretty wide range of approaches here, but there's some things that stand out. The first one up there is making professional mental health care more accessible. That one is more clinically oriented. That's about like accessing therapy, making it easier for people to get therapy. But most of the other ones are not so clinically focused. They're really, you might think of them as, they might seem a few steps away from what you might think of as mental health, but we heard really clearly from the roundtable in our planning process and from the young adults we interviewed and got feedback from along the way, that building community connections and supporting people and adding meaning to their lives are essential to building resilience and supporting well-being. So this is what a community level response to what can seem like a clinical issue, this is what it can look like. It's not just focused on therapy, it's focused on these broader building connections. So in terms of how we're going to implement them, we are right now actively in the middle of figuring that out, and we're working with the leadership of young adult organizations in the St. Louis Jewish community to determine which of these strategies we should pilot, which we should iterate, which we should implement. Are there some of the young adult focused organizations are already doing some work that is aligned with these strategies. So if there's similar work already going on in the community? How can we strengthen and expand upon that work, help it reach more people, give it additional resources so that it can be more successful? So we're actively having those conversations now. And we also want to share the insights from this process that we gathered about mental health and well-being of young adults with the broader Jewish community leadership. And we've started doing that by, we already shared some learning at the rabbis meeting that Brian Herstig, our CEO, convenes every so often. Some information that we learned from this experience that specifically pertains to synagogue settings. So we're trying to share what we've learned as broadly as possible within our community so that people can act on it, even if they're not specifically implementing one of these strategies. So now we're going to play a video of me doing a little interview with Dr. Erica Buckhalter. Erica took part in the Young Adult Mental Health Roundtable planning process as a participant, as a community member. And she also recently joined the Assessment and Planning Subcommittee and is now serving on a lay leadership role overseeing this mental health work. So she's bringing a lot of different perspectives, and she really wanted to be here tonight, but unfortunately she had a conflict. So we recorded this video so that she could still participate. So I'm going to stop sharing my screen and we will share the video. Hi, Erica. Thank you so much for agreeing to do this video. I'm so glad we're able to have you be part of this program, even though you're not able to be here in person. And I'm really excited for everyone to hear from your perspective as someone who's been involved with this mental health work as a lay leader and as a participant in the planning process, what it's been like for you and what your thoughts are about it. So if you could start by just introducing yourself, that'd be great.
Yeah, thanks, Nava, so much for inviting me to do this. I'm Erica Buckhalter. I'm a psychiatrist with Mercy Health in the outpatient clinic, and was really excited to be involved in the mental health planning aspect. And since then, I've joined the Assessment and Planning Committee with NAVA and the Federation, further looking at mental health and how we approach that.
We are so happy to have you on that committee and involved. So I shared with the group already about the Young Adult Mental Health Roundtable we convened to go through this planning process and strategize around this issue. So I'd love to hear from you. What was it like for you to participate in that roundtable? What did you make of it? What was interesting about it?
It was a great opportunity to bring together different people and leaders throughout the Jewish community, and also people not necessarily involved in specific organizations, but who have input around either as young adults themselves or people with experience treating or working with young adults in mental health. And so it was a great experience that was very well led and organized to be able to really ask the questions of what do we want the approach to mental health care to look like within the Jewish community? What are we already doing and what could we be doing better?
And I know you mentioned you're a mental health clinician, you're a psychiatrist. And as we've shared when we showed the group the strategies, most of them are not clinically focused. They're more community level, broader approach to mental health. So I wonder if you could just speak for a moment about what you see as the value of that approach to supporting mental health and well-being.
Well, I think especially since there's such limited access to seeing a psychiatrist in psychiatric care, that primary care physicians are doing the bulk of mental health work, except for a very severe mental illness. What does that look like then to take a community approach and to look at other aspects of mental health other than medication management and psychotherapy? Taking and focusing on the big piece in my mind, which is community, and how can we leverage our community organizations to be providing support and some resources for patients, or not for patients, for people in general before they need to go in and see a psychiatrist or a therapist or even their primary care physician.
Yeah, absolutely. I think I'm finding it really fascinating as I'm sharing these strategies with different people in the community, how much they resonate with people as connected with mental health, even though at first glance, some of them might feel like a step or two removed from what people think of it. So yeah, thank you for sharing that. As we're looking forward and figuring out how to implement the strategies and what that's going to look like, what are you excited about?
The word community, I'm going to say it again, that I really think that health and healing and support really rely on community. And what an opportunity we have here in St. Louis, where there's already the Jewish community in place to be able to develop things and look at developing leadership programs or other things where the rabbis or other lay leaders, people already involved in organizations, may need a little bit more support to lead different types of programming, but can go ahead and implement things in a structure that already exists to provide more places for congregants and Jews within St. Louis to come together and support each other.
Wonderful. Thank you so much. Anything else you want to share?
Just that it has been a great experience being part of the committee and really thinking on a broad scale and thinking about this structure and assessing what we have and thinking of other things that we can do to improve mental health in general and support and community and connection.
Awesome. Thank you very much, Erica, for being part of this. And we'll talk soon.
Take care.
All right. So that is our assessment and planning deep dive for you all today. And I'm going to turn it over to Amy.
Hi, everyone. I'm Amy Bornstein, the manager of major gifts at Federation, and it's been great to be able to work on this project with the Professional Society. At this point, we are going to open it up for questions. This is a really great opportunity to have direct contact with these wonderful staff from our community impact team. So please feel free to ask them questions. You can raise your hand or come off mute and ask your question. You can type it in the chat to everyone, or you can also type it just to me and I'll be happy to ask. But hopefully some people will have questions and take advantage of this great opportunity to talk about our needs assessment. Go ahead, Leslie.
Yeah, couple of questions, well, several. Did we develop these models or did we take from other areas to develop these models?
So the 6-step model, like the cycle, is that what you're talking about? Yeah. So that was developed as part of the 2017 strategic plan that was adopted. That was before I was at Federation. So I don't know, Emily, if you can shed any more light on that. But I think it's sort of based on how people approach figuring out kind of like social science, community level problems in general, figuring out what the need is, figuring out how to address it, addressing it, and then seeing how you did. Did you meet it or not? So there's some kind of core elements to that I've seen in other places. But I think something that's exciting for us is that there aren't really many other federations that are basing their work on a model like this. So that makes us stand out as a federation on the national landscape.
It makes a lot of sense. So congratulations on that. And my next question was, did we commission the Brandeis study or did they just happen to pick St. Louis?
Great question. We did not commission it. They were doing a national study. There's a center at Brandeis that does like Jewish community studies of various kinds. I'm not sure exactly what the origin of this was. Do you know, Emily?
Yeah, I can jump in.
Okay.
They during COVID, we heard through conversations with other federations that Brandeis was going to be doing a national study. to understand the impact of Jewish engagement and Jewish identity, the impact of COVID on Jewish engagement and Jewish identity. And so we connected with them, and it was a great partnership where I think they worked with 7 other communities. It was sort of like like any community that was willing to buy into that. But we learned a lot from participating in that process.
And I don't mean to jeopardize, but my final question, how long have you been working on this mental health initiative? How long has that been? I think you mentioned 2018.
So 2018 is when the board finished setting the priorities that we have. So they set mental health as one of the priorities, but this needs assessment and planning process. So we got the data last year from the Brandeis study, and the planning process really began like in February of this year.
We're moving along. Great. I think it's great. Thank you. I'm finished.
Thanks for your questions. Yeah, Neil.
Yeah, thanks. I have a question. Are there any initiatives that are farther along where we've actually implemented or gotten to the point farther along? Is there anything like that?
Yes, in 2018, we completed a very in-depth needs assessment on the needs of older adults at risk in our community. And that went through an entire community planning process to come up with a community-wide initiative to coordinate care for older adults among the different Jewish organizations who focus on older adults. So that has really gone through our entire model and is now farther into the implementation process than this mental health example is.
Terrific.
I can add another example. Before we had this formal like 6-step model, we had been doing a lot of research and work with the Jewish early childhood directors because early childhood is a high priority of ours. So over the last 5 years, we've done a lot of different research with them and invested in a couple of different initiatives. We just made a big investment. So we found new needs during COVID and made a new investment, but prior to this year, we've made investments in them as well based on needs that we had identified through some assessments.
I do have another question, Emily, that came in. What other needs assessments are you doing right now for Emily and Nafa?
Great question. We are working on, so I mentioned that Federation did a few COVID focused needs assessments last year. We're doing a third one right now to get an updated understanding of the impact of the pandemic on our community, since it's been about a year since we've done one. The last one was last July. And the pandemic is in a different stage now. We're sort of at an inflection point, hopefully, with the pandemic. So we're doing another needs assessment focused on that, which we're trying to learn about the impact of the pandemic, both on our organizations in our community and also on basic human needs. So those are kind of the two areas of focus for that. Then we have our mental health one that I told you about. We're also getting ready we're in the very beginning stages of thinking about our next community study. You might remember that our last one we did in 2014, that is sort of like the parent of all needs assessments. It gives us a really large and deep amount of data to help us understand the needs of our community. So we're getting going on that. And then we have, like Emily mentioned, and like I mentioned a minute ago, our older adults work and our early childhood focused work are really in that implementation phase. So that's kind of what's actively happening right now in terms of needs assessment and planning.
Nava, can I
Thanks.
just add something? First of all, thank you so much to Emily and Amy and Nava for doing this. You guys have done a terrific job. Obviously, you know way more about this than any of us, so it's even great for the other staff members to learn really specifics about your work. But what I wanted to point out was Nava was just saying about our regular community investments, and that is the money that comes from the annual campaign. That's the year to year, the 9 whatever million dollars that we're able to raise in the annual campaign. And when you talk about special projects like for seniors or for sometimes for security or sometimes for mental health, those are other needs that we develop special project funding for. So when you meet with somebody from the development staff, they may be asking you for more than one thing. They may be asking you to consider something for the annual campaign. They may be asking you for special support for a special project when we've identified a big need that cannot be met by the resources of the annual campaign. So when you talk to Federation staff members, you can ask about other programs that we are raising money for.
Okay, well, with that, we appreciate all of your time and it is so valuable to us. So we are going to turn it over to Jim to close us out.
All right. Well, thank you so much, Nava and Emily, for that awesome and informative presentation. We are also proud of the great work that you and your team do at Federation, and we are really looking forward to next week's session with Emily Bornstein on investment and valuation. And as a reminder to all of you on this call, you are automatically registered for session 2 next week and will receive a Zoom link in advance. Thank you again to our sponsor, Reuben Brown, and we hope everybody has a wonderful evening and we'll see you all next week. So thank you very much.